Good day. Today we will talk about how to treat atrial fibrillation. I tell my patients that there are 4 major pillars of atrial fibrillation treatment, and we'll talk about each one. The first pillar is to control the heart rate. If you recall, when the heart is in atrial fibrillation, the heart's junction or the AV node is sending a lot of beats, about 100 to 150 beats per minute. And that is why the patient's pulse is elevated when they are in atrial fibrillation. We need to control this by controlling the number of firing impulses from the top chamber to the bottom chamber. So while we are not suppressing the atrial fibrillation, we are suppressing the heart rate. A very simple way to do this is give medications like beta blockers, calcium channel blockers, or digoxin. These medications work on the junction or the AV node and make it work better, so it sends less electrical signals or impulses to the ventricle. Another thing we can do is actually destroy or burn this junction, but this then requires you to be pacemaker dependent. The second pillar of treatment is to put the heart back in rhythm. This is especially important if you have heart failure, where the heart really needs good rhythm to work to the best of its capacity. The fastest, quickest, easiest way is a procedure called cardioversion. This is a temporary reset or a jump start of the heart. We hope that the normal pacemaker wakes up and takes control of the heart with this procedure. Another way is to give you specialized drugs called antiarrhythmic drugs. Some examples include amiodarone, dronedarone, sotalol, dofetilide, flecainide, propafenone. These drugs are about 30 to 65% effective. The next way is to do something more durable, which is a minimally invasive procedure called an ablation, which we talk about in another video. Ablation on average is 70 to 80% effective. The third pillar is reducing the risk of stroke. The way to reduce the risk of stroke is by using blood thinners or devices called left atrial appendage occlusion devices, such as Watchman, Amulet, etc. The fourth and final pillar is very important. This is something which you as the patient can control. This is related to risk factor modification. It is very important that your medical conditions are as well treated as possible with the help of your doctor and the team. Strict control of your blood pressure with the goal blood pressure of less than 130 for the top number and 80 for the bottom number. Your diabetes should be well controlled with your A1C as low as possible. If you have heart disease, vascular disease, or stroke, please make sure you are on the best medication combination to lower the risk of recurrence, which can make the AFib worse. So losing 10% of your body weight in the first 6 months has a huge impact on AFib success. And you could lose 80% of weight with diet and 20% with exercise. Alcohol increases the risk of AFib and makes the treatment less effective. There are studies to show that no alcohol is the best way to fight AFib. 80% people with AFib have a very common condition called sleep apnea, which, if treated, can lower the risk of AFib. And the important thing to recognize is that you may not have common symptoms of sleep apnea, but your test may come back positive, and this would affect how we treat AFib. Exercise is very helpful for atrial fibrillation. Exercising about 30 minutes every day can help your heart get stronger. There are very few times a cardiologist will tell you not to exercise, and AFib is not one of these cases. So in summary, there are 4 pillars of treatment for AFib: rate control, rhythm control, stroke prevention, and risk factor control. So by controlling your heart rate, putting your heart back in rhythm, using blood thinners or devices to reduce the risk of stroke, and controlling your risk factors, we can fight AFib. Thank you. This is Dr. Mehta.